Welcome to the Pharmacy channel, where science meets wellness. I'm Dr. Hosam Khalaf, a certified clinical pharmacist. Today, we're tackling a silent epidemic, insulin resistance, a root cause of weight gain, diabetes, and heart disease. But there's hope. We'll uncover the real causes of insulin resistance, 3 proven steps to reverse it naturally, and how berberine, a powerful plant compound, can be a game changer. Let's dive in with insights from Lange's Basic and Clinical Pharmacology, Lippincott's illustrated reviews, and leading health authorities like the ADA and Diabetes UK. This video is for educational purposes only and does not replace personalized medical advice. Always consult your healthcare provider before starting, stopping, or changing any supplement regimen, especially if you're pregnant, nursing, taking medications like blood thinners, or have a medical condition. Insulin resistance, the hidden culprit. Insulin resistance occurs when your muscles, liver, and fat cells ignore insulin's signal to absorb glucose. Think of it like a broken doorbell. Your pancreas keeps ringing, producing insulin, but the door, your cells, won't open. Here's why this happens. Excess belly fat. Visceral fat releases inflammatory chemicals that block insulin signaling. Sedentary lifestyle. Inactivity reduces muscle glucose uptake by up to 40%. Processed carbs and sugars. High glycemic foods spike blood sugar, overwhelming insulin pathways. Sleep deprivation. Just 3 nights of poor sleep can induce insulin resistance. Chronic stress. Cortisol raises blood sugar, forcing your pancreas to overwork. Left unchecked, this leads to prediabetes, type 2 diabetes, and even Alzheimer's, termed type 3 diabetes by researchers. 3 steps to reverse insulin resistance naturally. Step 1. Move more. Exercise as medicine. Aerobic exercise, like brisk walking, boosts insulin sensitivity by 50% within weeks by activating AMPK, a cellular energy switch. Pro tip. Resistance training builds muscle, your body's largest glucose sink. Step 2. Eat for stable blood sugar. Focus on low GI foods, leafy greens, nuts, and fatty fish. Avoid sugary drinks, they double diabetes risk. Science hack. Cinnamon and apple cider. Vinegar improve insulin sensitivity by 20-30%. Step 3. Prioritize sleep and stress management. Just 7 to 9 hours of sleep lowers fasting blood sugar. Try mindfulness. It reduces cortisol by 28%. Berberine. Nature's insulin sensitizer. What is berberine? Derived from plants like golden seal, berberine has been used in traditional Chinese medicine for 3,000 years. Modern science confirms its power. Health benefits. Lowers blood sugar. Comparable to metformin, reducing HbA1c by 1-2%. Boosts metabolism. Activates AMPK, mimicking exercise effects. Reduces inflammation. Lowers CRP, a key inflammatory marker, by 30%. Supports heart health. Cuts LDL cholesterol by 20%. How it works for insulin resistance. Enhances insulin receptors. Increases cellular docking sites for insulin. Liver fat reduction. Slows glucose production in the liver. Gut microbiome. Promotes beneficial bacteria that improve metabolic health. Side effects and precautions. GI upset. Start with 500 milligrams per day to avoid nausea. Drug interactions. Avoid with blood thinners or diabetes meds. Risk of hypoglycemia. Pregnancy warning. Unsafe as it may cross the placenta. Dosing guide. 500 milligrams, 2 to 3 times daily before meals. Pair with liposomal formulas for better absorption. Berberine isn't a magic pill, but combined with diet and exercise, it's a potent tool. Always consult your doctor, especially if you're on medications. For more expert-backed health tips, subscribe and hit the bell. Drop your questions below. I'll answer them.